Hi everyone. Today I will be presenting an interesting article which is related to my field of work since I work with brain tumor patients. The title of the article is Patients and Caregiver Perceptions of Communications of Prognosis in High Grade Glioma. For the people who don't know glioma, it is nothing but a very aggressive brain tumor. Um, the author of the articles are E.A. Loeb, GKB Hellcat, and AK Novak. It is an Australian based article, and the authors are Australian. It is published in the Journal of Neurooncology in August 2011, issue number 104, and you can find it on page 315 to 322. I will be also putting the link to this description. Um, the article corresponds to the chapter, to the textbook chapter 14, which is nothing but communicating with patients with chronic illnesses, and also chapter 16, that is communicating with negative and resistive patients. The healthcare provider can find this article very interesting, specifically when dealing with patients with chronic illnesses such as cancer, and also how to react when faced with the initial shock by the patients. The paper focused on patients and caregiver perception of the initial communication about the diagnosis of high grade glioma and their prognosis. It was done by interviewing 19 patients and 21 caregivers. The details of demographics and the interview questionnaires are in the article, and I don't want to go in details about it. Don't want to waste more time. I would actually summarize the content of the article in three main bullet points. The first one: the patient and caregivers were shocked after the initial communication surrounding the diagnosis of high grade glioma and its prognosis by the providers. The patients and the family members were having difficulty in understanding and processing the detail of the prognostic information, where they were in the state of shock and distress. The patient were informed of their diagnosis and complete prognosis abruptly after surgery, and I feel this is a very ineffective communication because it was relayed in one meeting rather than several stages. The patient had no time whatsoever to process the diagnosis or the illness related information before listening to the prognostic plan. The second most important point is the clinicians were not effective in communicating the individual prognosis to each participant. Um, During the interview, the caregivers and patients mentioned feeling of hopelessness, fear of loss. They perceived the communication very blunt, brutal, and very uncaring. Uh, the prognosis relayed was very generalized, and caregivers felt that the overall survival time was not relevant to their patient history, and the trust was never established with their providers, which is very crucial. It is also very crucial to balance honesty with the hope of clear communication following a poor prognosis. Patients need to be reassured that they are not alone, and the clinicians and the staff will do everything possible throughout their treatment. And the last but not least, the conclusion. The conclusion of the articles clearly says that more training should be offered to inexperienced providers to better communicate with patients in a state of distress. Um, there are multiple examples of effective, ineffective communication skills of experienced and inexperienced clinicians when speaking to patients. The experienced clinicians were very well compassionate and empathetic to the patient and caregivers. Uh, it also the article also give emphasis to the future research, which may require development of specific guidelines for high-grade glioma patients and their caregivers, particularly giving emphasis on method of how the information should be delivered, specifically for patients who have really bad cognitive defects. Well, the article indeed has its own limitations, and I have discussed some of those limitations in my discussion questions. So here they are, five discussion questions. I'll review one by one. The first one is, would the patient and caregiver perception alter if the clinicians were more experienced in communicating diagnosis and prognosis to the terminal illness? My second question, is there is more effective method of communicating uh, difficult findings and prognosis to terminally ill patients? Third question, would focusing on certain demographic factors when selecting studies, when selecting study participants such as education status, socioeconomic status, employment status, and caregiver status would differ the study results? Fourth question, would establishing a co-relationship between the demographic factor which I just mentioned to you and the patient and caregiver perception be most successful in the future studies? And the last but not least, would the study result differ if the geographical locations were changed? Well, I am hoping that you like this article, and I would be looking forward for your responses. Um, have a great weekend. I really enjoyed this class and enjoyed listening to all the audios and videos of other fellow colleagues. And yeah, have a great weekend. Thank you.